According to statewide data released on Saturday, February 26th, New York recorded a positivity rate of under 1%. After 51 days of a downward trend in positive cases,
my friends, the day has come. Today we are going to be announcing that we'll be lifting the statewide mask requirement in schools, and that'll be effective this Wednesday, March 2nd.
And the mandate isn't limited to children in school settings.
That includes children who are in child care centers ages 2 and up who are covered right now.
According to Hochul,
70% of the population right now lives in an area that's considered low to medium risk.
Like the majority of the state, Steuben County officials say they're seeing a sharp decline in COVID cases.
We're averaging, on the 7-day rolling average, we're averaging about 17 cases a day, which is far less. At our peak, we were over 300 a day.
If a county, city, or town starts to experience a higher rate of transmission,
we will allow them the flexibility to determine what's best for their county. We would encourage them to take a look at this and follow the CDC.
Between herd immunity, vaccination rates, and pandemic-related precautions,
at this time, we definitely have reached a point where we are at probably our most normal point in the entirety of the pandemic.
And some parents may be wondering if they should continue masking their child in school.
There's no harm in wearing a mask. It's really just, can it be done, throughout the day comfortably for the child? And that's the hardest part about it.
Dr. Nistico says the risk of spread in educational environments can be a bit of a gray area.
It's not to say that at this time, your risk of getting sick is super high. It's not because we know that the rates are very low. But I think that it really depends on the environment you're looking at.
For the time being, local officials are keeping an eye on coronavirus numbers and working with health experts to decide what's best for the community.
Really trying to figure out what's happening, because that's the number one concern is hospitals with this and the severity of disease.
For Arnot Health, I'm Lexi Cutmore.